Hello everyone and welcome to the latest in our series on the ADP channel on privacy and cybersecurity. Today I'm delighted to be joined by a number of panelists who will introduce themselves in a second. I'm here with David Clark, my business partner. Hi David. I'm also here with Liz Coker from 3P Health. I'm here with Tara Cho from Womble Dickinson, an international law firm, and John McNulty from DigiBridge. So John, would you like to start by introducing yourself?
Yeah, I'm John McNulty. Very nice to meet everyone here this morning. I'm CEO of DigiBridge, and DigiBridge is a privacy-focused marketing communication, technology, and consulting company based out of Chicago, USA. Very nice to meet everyone.
Thanks, John. And Liz, tell us about 3P Health and yourself.
Hi, I'm Liz Coker, co-founder of 3P Health and am a certified information privacy manager through the IAPP. And we are working to bring personalization and privacy together in order to help people through their daily journey, wherever that may take.
And Tara, you're working with the international law firm Womble Dickinson across both privacy and a little bit of healthcare as well.
Yes, that's right. I chair our U.S. privacy and cybersecurity practice. Womble Dickinson is a transatlantic law firm with offices across the U.S. and the U.K. And my practice is specialized in privacy and data security with a special interest in healthcare and life sciences.
Great. It's pretty topical, the subject of healthcare and privacy at the moment. The Irish Healthcare Service, as you may well know, was subject to a ransomware attack back in May this year. I think the hackers were looking for $20 million US. I think they're still negotiating on that, and certainly the healthcare system has been very badly affected for months. Over here in the UK at the moment, there's a big discussion going on because the government would like to be able to aggregate data and also anonymize data to be able to sell that to third parties. And there's been a bit of an uproar over here amongst us, the citizens, who are a little bit nervous about our healthcare information being, even though anonymized, being available to third parties. So there is in the US, Tara, a law, HIPAA, which covers the privacy of patients and data subjects, isn't there? Can you tell us a bit about that?
That's right. So the federal law is HIPAA, the Health Insurance Portability and Accountability Act, which its primary focus at inception was to ensure continuity of patient care and sort of speaking the same universal language across healthcare entities through standard transaction code. So there is a component that focuses very narrowly on the privacy and security of that information and the limitations on how it can be used. One interesting thing is that as more and more US states develop laws like California's, we tend to see a carve out for data that is regulated by HIPAA. So a little different than the European model, we have a very sectoral approach where healthcare entities are subject to one set of laws and banking and finance subject to a different set of privacy laws. And so then with the disparate impact of state laws and these carve outs, it's a lot to navigate. But one interesting point to note, because I know what Liz and John do, they probably deal with this regularly, is that you could have the same list of data elements like your name, prescription, diagnoses, etc., when held by a health app or someone other than what HIPAA refers to as a covered entity or business associate that is not subject to HIPAA at all, but when in the hands of those covered entities or their service providers, it becomes subject to HIPAA. So it's an interesting place to be where the data its controls are determined by I guess what we would think of as the data controller, rather than the information itself and the sensitivity of the information.
And that's
so in practical terms, right? The same data that gets sent to your doctor to manage your health is protected, but that data, if sent via a Fitbit, up to Fitbit, can be, based on their terms and conditions, can be sold or shared with third parties.
And John, that's one of your favorite bugbears, isn't it? That this data is being transmitted all over the place via not necessarily using secure means. John.
Yeah, I mean, the data, what we focus on is public internet communication privacy, because what's happening, a lot of the cybersecurity people that we talk to in the US here, they'll say that, you know, to access pretty much everything that hackers need to access, you don't need to get North Korean hackers anymore. You can pretty much get in through the wormholes that are provided by the public internet, very porous communication ecosystem. I mean, it's called public internet for a reason. It was the DNA of the public internet was always meant to be mineable. And that is the big problem, because often the people we talk to, they're not aware. They're not aware that they are enabling, and we call it that you're an enabler. They're not consciously selling the data or consciously making the data available to for you know, purposes that weren't planned, but they are enabling it. And when we point out how they're enabling it, because we often start out by doing what we call a PIC, a public internet communication privacy audit. And they're like astounded. They can't believe that they're enabling the sharing of healthcare data. Like, how is that happening? We didn't know that. No, you don't know that because you're outsourcing all of your public internet communication basically to advertising agencies, because they're the experts on it. And the advertising, you know.
And when you say they, who are you talking about? What sort of people are you referring to there?
Okay, medical centers, clinics, technology companies, almost every sector of business that we do these privacy assessments, privacy audits on, they're all, you know, they're unknowingly enabling it. Okay, so this information is just flowing, you know, it's available to all the data brokers, and, you know, anybody that wants to contact the data brokers and use it for whatever purposes they want to use it for. That's what's happening. And the big wormhole is the public internet communication ecosystem, which includes visits to websites, social media, apps which write on Android, email. You know, if you have Android, you have to have Gmail. If you have Gmail, it's really not private. You know, the belief exists, and you can look this up. There's been all sorts of lawsuits that, you know, that they're reading, you know, Android's able to read all the Gmail. So yeah, it's a big you know, like I said, a public internet ecosystem is called public for a reason. It was always meant to be open and mineable. That's the problem.
So Tara, how come these companies are not covered by HIPAA, for example, for this?
Well, HIPAA was, as you guys know, you know, HIPAA was written. I mean, my wife, as an example, who's a board advisor to our company, manages clinical research trials for Indiana University Medical Center. Prior to that, Boston University Medical Center. And like she always says, it's, you know, privacy is a big concern to them. They're involved with a COVID-19 clinical research trial now. She manages that personally. But you know, HIPAA was written prior to the internet, so it was you know, it was not written to protect public internet healthcare privacy, because it didn't, you know, you couldn't anticipate what was going to happen. So now that's a big problem. You know, the Hippocratic Oath, like, if you read, you guys are more experts on this than me probably, but I mean, you know, the Hippocratic Oath also promises privacy. I mean, that's what it says. You know, we will do our utmost to protect the privacy of our patients. And in the digital era, and they're not doing a very good job of it. That's unfortunately the reality of it.
So Tara.
Yeah, I think that there are some interesting contributing factors, not to just jump to the defense of the healthcare entities, but one major issue to combat is the understanding of the public and the patient population of the vulnerabilities that they themselves are introducing by exposing their data. It's really interesting day to day across sectors that I work in to see how much information a consumer will give up freely on social media, and yet get very up in arms about something that their healthcare provider may be trying to do directly for their benefit on a closed loop information sharing just to get them healthcare. And, you know, to your point about the HIPAA regulations predating modern technology, I for one think that that's why we have such an issue in today's attempts to legislate around cyber standards, is because we have to keep it flexible, which I think HIPAA does a good job of not making it mandated that every size entity has to have XYZ cybersecurity controls, but has a flexibility based on their resources and capabilities, and most importantly, the type of data they store for a risk-based approach. And, you know, as more technology becomes available, we see that scale slide. So even though something might not be mandated as a control, like encryption, for example, is an addressable security control under HIPAA, but it's essentially expected and anticipated, even though strict read of the rules would indicate you could use alternative means to secure the data if it's reasonable and appropriate. But I think those trends across the industry are shifting, but we still have to allow for flexibility based on a government-funded VA hospital that has $0 to contribute to this versus, you know, a private institution with more money behind it.
I mean, one of the things that I've seen working with customers and clients over the years is that depending on the size of the business, the size of the practice, right, it really determines what they may or may not do. So some doctors here in the US still have paper records and they communicate over email, many with Gmail and AOL accounts and things of that nature. Whereas if you were to go to a large organization such as a Kaiser or a Geisinger Health, right, no communication is happening unless it goes through their secure messaging on their electronic health record, you know, through their electronic health record. And so you have this incredible disparity from practice to practice. You have consumers that don't really understand what the internet is, what it does, what the risk factors are. You have people looking to get answers. So Patients Like Me is a large online health social media platform, right? And I was curious about them. So I called and I asked, well, what do you do with the information that's shared? Because people are sharing really pretty personal information on there. And, you know, they sell the data to pharmaceutical companies. They don't sell the data, at least at the time, they did not sell the data to other types of organizations, but there was nothing necessarily that prohibited them from doing it, since people share openly in an online action. And John, you can probably confirm this, but talking with a lot of security professionals, they will typically say, right, the number one point of vulnerability for any network is the user. It's people. Not understanding,
totally correct. Yep.
Going too fast. Yeah.
Yeah. Yeah. You brought up an interesting topic there. Patients Like Me, and this is, you know, just a food for thought in terms of who can access the data, who may have interest in the data, what might they do with our healthcare data. Okay. When we speak at universities, we go back a number of years in like follow the money, right? So if you do research on Patients Like Me in Ancestry.com, you're going to see an enormous amount of Chinese money. Okay, now we see in the news every day the concerns that we have about China mining our data, and they're mining our healthcare data. Okay, now we are in discussions with the Wall Street Journal right now, and we've had extensive collaboration with the Wall Street Journal. And Okay, what could you do? Okay, what could the Wuhan lab do in terms of, let's say, the bioweapons that they're working on, which is common knowledge, is not debatable. Okay, if you had enough information on healthcare records of the various countries around the world, particularly the number one adversary in the US, what could you do with that? Okay, so I won't go further on that where I'm headed, but the point is that there's a lot of people that are interested in mining the healthcare data of Americans for a wide variety of reasons, strategic, global, competitive reasons. So that's something, and you can look it up. You can look up the investor money behind, Patients Like Me, Ancestry.com, et cetera, et cetera. You follow the money, and all of a sudden it's like, why are these people? Why are they interested in this? Then you could come up with your own. I won't speculate here, but you can come up with your own thoughts or ideas or logic.
But John, aren't we kind of talking a number of different levels here? If we're kind of talking nation state cybersecurity,
exactly,
against someone who's ill, who needs treatment, and I know when you're kind of ill, when you go to the doctor, data protection is not number one on your list. It's kind of like number 10. Can I get better? An exploitation of patient data by nation states is surely a government issue rather than, a patient or a doctor or a, national chain of hospitals.
Yeah. Well, let me throw here's some snippets of data that we've relayed to the Wall Street Journal. And this, I'm not going to draw conclusions. I'm just going to ask questions. Okay. Why is COVID-19 death rate 33 times greater, more lethal in the USA and the UK than it is in Southeast Asia? That's a statistical fact.
Well, I think those stats are wrong. Just look at India. Yeah, they don't even have proper stats, and they're beating every country in the world hands down.
Okay, no, but okay.
And that's not a cyber question or a data protection question.
But let me. No, it's a data mining question. Okay, and
sure, but if you data mine purely at that level, you will get the wrong answer. It's kind of, if you ask anyone in the world what is the most dangerous place to go, and the answer is a hospital, because more people die in hospital than any other place.
No, but
when you drill that, when you drill down the data, you find that people in hospital beds die at a much greater rate. So the conclusion from that doesn't work.
I know, but that wasn't.
We're kind of going off the point a bit here, so I'm probably going to edit quite a bit of
Okay.
No, what I'd really like to come back to really is the privacy issue. So if we could just bring that back a wee bit on data and data sharing. Liz, we had a conversation last week about the benefits of data and maybe aggregating some of the data that we're collecting about people.
Right. So, specifically in the healthcare space, right, there are incredibly good reasons to aggregate and share data, right? If you're looking at issues such as medical research, medical research, finding towards determining what to prioritize your R&D spending on, right? Just being able to look at multiple data points and get a better context of your patient, right? So in the US, I'll speak to the state of Colorado, there's a focus on community, understanding a patient's community, looking at behavioral health, physical health, food insecurity, housing insecurity, energy insecurity, all of these types of things, because these are the social determinants of health that when you can understand them, you can create a more personalized treatment or prevention path and get people the services that they need, right? So in healthcare, there are so many altruistic reasons to share data. I believe that in the UK, right, that always it was somewhat carved out that HHS data, health data, could be used for research purposes, aggregated data, right? But then people start looking at it for additional purposes for which people really either are unaware or have a visceral reaction to, right? And so the challenge for data management, data privacy in this space really comes down to purpose, right? There are plenty of ways to protect it. You can train people to be more aware, although you're always going to have issues with individuals. But it comes down to, do people really understand purpose? Do they understand sale versus sharing? I mean, HIPAA wasn't designed to protect my health information. HIPAA was designed to facilitate billing and sharing of data between health providers, right? It wasn't designed as the Consumer Health Privacy Act, right? It was portability of data so that it could be easily shared. And some thoughtful people thought ahead and said, well, we should also be protecting that data that we're sharing because it should be held confidential. But it is this context of how the data is used and the purpose that really is the biggest challenge, particularly here in the US, because there is no overarching law. Every state is different. Every doctor's office. I had one doctor I worked with years ago who would not let anybody go onto the internet except himself on one computer that wasn't attached to their network, because they really didn't understand what HIPAA meant and whether they could be fined or not. I mean, it's purposely vague to be flexible, but it's also so vague that you get huge discrepancies. So as always, context is probably one of the root issues as it relates to privacy. And there is just not the expertise for the most part, certainly not in the patient-facing, consumer-facing part of healthcare, to explain choices, options, uses to customers in a meaningful and
But Tara, it's true, isn't it, that there are only certain organizations that are really covered by that. So the social media companies, the wearables, people like that, and people are very willing to wear wearables that track various pieces of their, in what their body's doing, hydration, fatigue, all of it, speed, the number of steps they take a day. So there's a lot of information going to these organizations that the consumer is very happy to let them have.
And I think that's the important factor. Like I mentioned, it's difficult to have a black and white regulation on what security standards you have. It's a little bit easier to say what you can or cannot do with data, but the issue there is also the evolution that was referred to in the original dates of HIPAA and before HIPAA. It was very insular within the healthcare sector and in clinical research to really use de-identified data sets. And now, if you step outside of HIPAA, you could ask 10 people what de-identification means and you would get very different answers. And also just between here and in the UK, what that means is very different. And I think the compounding factor is the technology that you're describing, where when you have an entity, a tech company that's not subject to HIPAA, collecting what we perceive as health information from a consumer directly, and then that consumer wants to turn on a switch that allows that data to go to their healthcare provider because it feeds into treating long-term diabetes and the behavioral aspects of your healthcare. And so there's an exchange of non-HIPAA data with HIPAA-covered entities, which is, creates a unique tension. But I would also say, to Liz's point, it's unfortunate that the altruistic use cases to enhance patient care and to develop new drugs and therapies is going to continue to be inhibited by the fact that other entities want to monetize that data.
Right.
There's a huge amount of derivative data that you could even get from de-identified information, use it to feed algorithms, and then you have another non-covered HIPAA, a non-HIPAA covered entity that's collecting all your data from your online activities.
Yeah.
So the ability to actually have a de-identified data set and prohibit somebody from combining it with another profile of that person is just becoming really difficult.
That is a phenomenal point. Phenomenal point.
And of course, the cat's out of the bag now. How do we put that cat back in the bag?
Yeah, that is such a great point that was just made that almost sums the whole thing up. here's an example. It's, we call it collateral damage. There's the data that we want, let's say in healthcare, we want healthcare institutions to have our data, kind of predictive analytics to try to give us better guidance, health and wellness guidance, keep us healthier longer, et cetera. The problem of it is what's happening with the public internet, and the consumers' increasing anxiety about privacy. I don't know, have you folks seen the front page of the Wall Street Journal today about Apple's healthcare initiative?
No.
It's really relevant to what we're talking about. Apple, 2 years ago spent, I don't know how many billions of dollars, it's in the article, to launch a major healthcare initiative. They have their own clinics now, they're like CVS or, Walgreens clinics. And they have their own doctors. They have it's like a separate company, and it ties into all of their, Apple Watch and all their other devices, this kind of, consumer monitoring of our, vital signs and health and wellness conditions and so forth. And they're probably going to pull the plug on the whole thing because they've been testing it with their own employees. They thought that would be the first place to do pilot testing where they'd have the most control. And what the article is showing is that their own employees are rebelling against it. Their own employees don't want to participate. They're so concerned about the data mining, what could happen to the data, collateral damage, who also could get their hands on the data, what could it be used for. So it's a significant, I think it's a significant concern about the future of telehealth as to how the consumer, it has a high level of anxiety about having their healthcare data, monitored, accumulated, possibly shared, gotten into the hands of the wrong people. It's a big article that's pretty eye-opening because we're very involved with telehealth. And one of the things we preach in telehealth is the importance to recognize this, the consumer's anxiety level about data mining and privacy and who could get their hands on this data, what could be done with the data, et cetera, et cetera. So if you haven't read the article, it's pretty interesting.
Why do you think that suddenly the data subjects or consumers, whatever, civilians have suddenly become aware of this? Because we joke in the UK actually that the Americans in particular have never really bothered about privacy up until recently, but it suddenly seems to be something that they're very, very focused on.
I think that, even outside the healthcare sector, I've seen over the last 5 to 6 years since the one massive data breach by a credit bureau that just caused the wave. It caused, legislation across the states to try to combat and make a big stick for what happens if you breach this data in this way, and a focus on consumer rights. But I also think, I think this is on the fringe of what John was talking about just during the pandemic. There's really a high level of distrust for the healthcare sector and almost, borderline paranoia as to what's being done with this information. That's why people were so upset about the concept of contact tracing and people or employers tracking where they've been. It just kind of crosses into a new line of invasion beyond, hey, we saw you looking at this product, we suggest this one.
Yeah, exactly. Huge points.
Yeah, I mean, marketers have done a big chunk of causing the problem. And I come from a marketing background, so I don't say that lightly, right? We have gone into the creepy realm, right? When you have friends that will talk to me about, I was talking to a friend about this yesterday and it showed up in my advertising.
Right.
Years later, right? So they wonder, is the microphone on their phone on? Are they being surveilled? And whether that happened or not, and it's a search they forgot, is irrelevant. People are now starting to see it between the data breach that Tara was just talking about and the Facebook Cambridge Analytica breach scandal, if you will. People are starting to learn starting to become educated about what's happening with their data. And while culturally here in America, we are kind of anything goes, and we'll do anything for a free t-shirt and a free search, right? And all of those types of things. When we actually feel that one of our rights is truly being wiped out, taken advantage, abused, things like that, we get pretty angry. We tend to have a pretty strong backlash, right?
Yep.
But also our regulators have been 10 years behind the technology on everything. And in the US, the industry lobbyists are the ones that are trying to write national privacy laws.
Yep.
And so there's a whole lot that just kind of happened all at one chunk to really bring this to the forefront. But I mean, I spend, probably an hour a week writing legislators, and please just begging them not to use the language given to them by tech companies, because they're planning for the obsolescence of the things that the legislators are paying attention to and understanding, and they're focused on what they're going to have 5 years, 10 years from now. So there's a shifting, definitely a shifting dynamic here in the US from a political and awareness perspective. And I do think that the pandemic and having to do everything online really got things going, and vertical integration of companies.
Yep.
If you look at Amazon, right now, they track everything you buy online, but they track everything you buy offline, right? If you're a Whole Foods shopper, and I choose not to take the discount if I'm at Whole Foods, because it's like, I've had enough, right? You can see this part of me, but I want to partition my data among multiple users, because I feel that it makes profiling me and potentially discriminating against me that much, well, less likely. It's still highly likely, but less likely, right? It's just a little bit that I can do.
I think it also, okay.
Awesome.
Go ahead, Tara.
Great points.
I think it also goes to that consumer education, because still consumers are having it thrown in their face that you have all these rights without understanding a lot of what we're talking about has been going on for decades, and you didn't have any problem with it. So for example, California passed the first omnibus privacy rule, and then you have all these, all at once, we've updated our privacy policy, you have all these rights, we're not going to sell your data. And people are thinking they're selling my data, but well, we're actually talking about digital advertising economy that's been happening for so long, and you probably didn't have a material problem with it, but when you see the word sell my data, you think they're making money off of my information, which isn't always the case. So sometimes the target of the legislation picks up things that I think make consumers even more paranoid. And yet again, they'll put their home address outward on Facebook and tell people when they're going to be out of town, and all kinds of things. So
It's crazy. It really is.
America is about convenience, right? And when you start to understand this, not to be dragged back into the previous quasi-political discussions here, but when you understand that Americans are very driven by convenience, and from a economic perspective, right, the gap between the haves and have-nots has gotten bigger over the last decade, right? For some people, they don't have a choice, right? If they use free services because they're free, and they don't have to pay for them, and they, in our minds, we thought, oh, that's like TV advertising, right? It's in the context of, and when it first started online, right, it was in the context of the search. It's in the context of the demographic who watches the television show. Well, marketing technology has advanced so much, right? Now that's not the case. I mean, there are places like DuckDuckGo where that is still the case.
Yep.
But if you look at, most of the other search engines other than Neva, right, it's about what you actually are doing and have been doing in the past. And so people are starting to figure it out, but in the end, Americans, right, when it's free and it's right there and it's easy and they don't have to think about it, right, we're in the habit. We are in a habit, and this is a really difficult habit.
Well, I was going to ask you all if you felt that given we're now becoming much more aware and the public is becoming much more aware of what's going on, did you have a sort of positive view for the future that perhaps we are going to be able to bring our private data back under control? But I'm not so sure that that's what you're all saying.
You know,
No, I think you're right. Here's okay for DigBridge to talk about privacy. You know, as I said, we're a privacy focused marketing communication technology company. And so we go to conferences, talk to universities, work with agencies, Procter and Gamble, et cetera, talk about privacy. But sometimes we feel like we're like the guy standing on the beach singing a song into a hurricane. Like it's really hard to get people to listen. We don't have a big enough megaphone. Okay, but along comes Tim Cook. He has a very big megaphone. Now everybody's listening. You know, the New York Times writes about it, National Public Radio, it's on the news at night, and CNN, you know, Wall Street Journal. Oh, what's Tim Cook talking about here? He's talking about privacy in marketing. What's that all about? We'd never thought about that before. So it's changing now, in our opinion, very quickly, because people like him are bringing a tremendous amount of focus and attention and awareness, and marketers and consumers are starting to ask a lot of questions. You know, we work with some very big agencies, people like WPP, people like Publicis, and they're on alert now. They're trying to figure out, where is this whole thing headed? This looks to me like this is them. Looks like it's headed to permission-based consensual marketing. You know, that's a big change.
Yeah,
but that's what he's pushing. That's what Tim Cook is pushing.
Right.
Yeah, there are a couple of things happening on the technology front right? So Apple has technology that is privacy enabling, right? So, and they're getting a lot of press about that. And there's a group called the Data Collaboration Alliance, right? And they're focusing on data access, not data copying, right? So that there's a single point of control for the data by the consumer, and people can access it. And then you can use other technologies like distributed ledger technologies, right? So that you can actually then audit and see who has accessed your data. And, you know, were they given permission or not, right? Was it used for the purpose or not? So there are technologies that are starting to come about, and there are organizations that are trying to address this issue. As you know, our company is one of those organizations trying to address that issue, where we give more choice and control to the consumer. It doesn't change that the internet is still the internet, right? And that it's driven by advertising, and there are a lot of free services that people want and value, and they consider it a fair exchange. But this push for transparency and this push for greater choice and control by the consumer, I think, is a trend that's going to happen. And I think that you're going to see people like this Data Collaboration Alliance working to make that more affordable for everyone, right? The majority of people in the world can't afford an iPhone. So, you know, what happens for the rest of them? And there are groups and organizations working to address that.
That's really good news. That's a very positive place to stop actually our discussion this afternoon. So thank you all very much. Let's reconvene, say, in 6 months' time, and have this conversation all over again, see where we're at.
All right.
Thank you.
Thank you.
Thank you.